If you're over 65 and sleeping on your back every single night, you could be increasing your stroke risk without even knowing it. And this is something most doctors never mention during regular checkups. What I'm about to share with you could literally save your life or prevent a devastating stroke. So please, watch this entire video, and if you know someone over 65, share this with them immediately. Welcome to Golden and Gray Hub, where wisdom meets wellness. I'm here to give you the health information that truly matters after 65. Now, before we get into the details, I need you to understand that sleep position isn't just about comfort, it's about survival. The way you sleep affects your breathing, your blood pressure, your brain function, and yes, your stroke risk. And what works fine at 30 or 40 can become dangerous at 65 and beyond. Let's talk about why sleeping flat on your back becomes risky as you age. When you sleep on your back, especially if you're over 65, several dangerous things can happen simultaneously. First, your tongue and soft tissues in your throat are more likely to collapse backward, partially blocking your airway. This condition is called sleep apnea, and it becomes much more common after 65. But here's what most people don't realize. Sleep apnea isn't just about snoring or feeling tired. Every time your airway closes, even for just a few seconds, your oxygen levels drop. Your brain isn't getting the oxygen it needs. When your brain is repeatedly deprived of oxygen throughout the night, your body goes into emergency mode. Your blood pressure spikes suddenly and repeatedly. These blood pressure spikes put enormous stress on your blood vessels, especially the delicate vessels in your brain. Over time, this creates the perfect conditions for a stroke. Research published in the Journal of Clinical Sleep Medicine found that people with untreated sleep apnea are 4 times more likely to have a stroke than people who sleep normally. 4 times. That's not a small increase. That's massive. But it gets worse. After 65, your blood vessels naturally become less flexible. They're not as elastic as they used to be. So when your blood pressure spikes during these apnea episodes, your vessels can't handle the stress as well. They're more likely to develop small tears or weak spots. These weak spots can lead to either a clot forming, which causes an ischemic stroke, or a vessel bursting, which causes a hemorrhagic stroke. Both are life-threatening. Now, here's something that really concerns me. Many people over 65 don't even know they have sleep apnea. They think snoring is just normal aging. They don't realize that gasping for air during sleep or waking up with headaches are warning signs. Their partners might mention the snoring, but they brush it off. Meanwhile, every single night, their stroke risk is climbing higher and higher. And sleeping on their back makes every single one of these episodes worse. There's another danger with back sleeping that people don't talk about enough: acid reflux. When you lie flat on your back, stomach acid can flow back up into your esophagus much more easily, especially if you've eaten within a few hours of bedtime. This is called gastroesophageal reflux disease, or GERD. Now, you might be thinking, what does heartburn have to do with stroke? Here's the connection. When acid reflux happens repeatedly, it can cause inflammation in your esophagus and throat. But more importantly, severe reflux can actually trigger irregular heart rhythms, especially a condition called atrial fibrillation. Atrial fibrillation, or AFib, is when your heart beats irregularly and often too fast. When your heart doesn't beat in a steady rhythm, blood can pool in the chambers of your heart. When blood sits still, it can form clots. And if one of those clots breaks loose and travels to your brain, that's a stroke. Studies show that people with AFib are 5 times more likely to have a stroke. And guess what? Sleeping flat on your back with untreated reflux can contribute to triggering AFib episodes. It's all connected. Let me give you another piece of this puzzle. Your blood pressure naturally drops while you sleep. This is called nocturnal dipping, and it's healthy and normal. But when you have sleep apnea from back sleeping, this natural drop doesn't happen. Instead, your blood pressure stays elevated or even increases during the night. Your body never gets that crucial recovery period. Over months and years, this leads to chronic high blood pressure, which is the #1 risk factor for stroke. Your brain vessels are under constant pressure, 24 hours a day, 7 days a week. Something eventually has to give. Now, there's one more critical issue with back sleeping after 65, and this one surprises most people. It's about blood flow and circulation. When you sleep on your back, especially if you have any kind of heart condition or poor circulation, blood flow to your brain can be reduced. Gravity works against you. Your heart has to work harder to pump blood upward to your brain. If you already have narrowed arteries, which is common after 65, this reduced blood flow during sleep can cause what doctors call silent strokes. These are small strokes that happen without obvious symptoms, but they accumulate over time and cause serious brain damage. Research from the American Academy of Neurology found that people who sleep primarily on their backs have more white matter damage in their brains. White matter is the communication network of your brain. Damage to it affects memory, thinking, and movement. And this damage is often caused by these tiny, unnoticed strokes happening night after night while you sleep on your back. So what should you do instead? The safest sleep position after 65 is on your left side. Here's why this position is so protective. When you sleep on your left side, your airway stays naturally open. Your tongue and soft tissues can't collapse backward as easily. This dramatically reduces sleep apnea episodes. Your oxygen levels stay more stable throughout the night. Your brain gets the oxygen it needs. Sleeping on your left side also helps with acid reflux. Because of the way your stomach is positioned, gravity actually helps keep stomach acid down where it belongs when you're on your left side. This reduces reflux episodes and lowers your risk of the heart rhythm problems I mentioned earlier. Your esophagus stays healthier, and your heart beats more steadily. There's another benefit to left side sleeping that's particularly important for stroke prevention. It improves circulation. Your heart doesn't have to work as hard to pump blood throughout your body. The aorta, which is your body's main artery, curves to the left. When you sleep on your left side, blood flows more easily through this natural curve. Better circulation means better blood flow to your brain, which means lower stroke risk. Now, I know some of you are thinking, but I've been a back sleeper my whole life. How am I supposed to change now? I understand. Changing sleep positions after decades of habit isn't easy, but it's absolutely possible, and it's worth it. Here's how to make the transition. Start by placing a body pillow along your back when you lie on your left side. This creates a physical barrier that prevents you from rolling onto your back during the night. Your body will naturally stay in the side position. You can also try the tennis ball trick. Sew or tape a tennis ball to the back of your pajama shirt. When you try to roll onto your back during sleep, the discomfort from the tennis ball will make you shift back to your side. It sounds simple, but it works remarkably well. Most people adjust to side sleeping within 2 to 3 weeks using this method. Another helpful tip is to elevate the head of your bed slightly, not with pillows, but by placing blocks or risers under the legs at the head of your bed. Raise it about 4 to 6 inches. This slight elevation helps with both sleep apnea and acid reflux, regardless of your sleeping position, but it works especially well when combined with side sleeping. The elevation plus the side position gives you maximum protection. If you're someone who moves around a lot during sleep, consider using a pregnancy pillow. These U-shaped pillows support both your back and your front, cradling you in the side sleeping position. They're not just for pregnant women. They're excellent for anyone who needs to maintain a specific sleep position for health reasons. Many of my viewers over 65 have told me these pillows changed their sleep quality completely. Now, let's talk about what else you can do to reduce stroke risk while you sleep. First, if you snore loudly, gasp for air during sleep, or wake up feeling unrested despite sleeping 7 to 8 hours, talk to your doctor about a sleep study. Sleep apnea is treatable. CPAP machines, which provide continuous positive airway pressure, can completely eliminate apnea episodes. They keep your airway open all night long. Yes, they take some getting used to, but they can literally save your life. Second, manage your nighttime eating habits. Don't eat large meals within 3 hours of bedtime. This reduces acid reflux risk. If you do need a snack before bed, make it something light and easy to digest. Avoid spicy foods, caffeine, and alcohol in the evening. These all interfere with sleep quality and increase reflux. Better sleep quality means lower stroke risk. Third, keep your bedroom cool. The ideal temperature for sleep is between 60 and 67 degrees Fahrenheit. When your body is too warm, your blood pressure can rise during sleep. A cool room helps your blood pressure stay in that healthy dipping range I mentioned earlier. It also helps you sleep more deeply on your side without waking up to change positions. Fourth, stay hydrated during the day, but reduce fluid intake in the last 2 hours before bed. This reduces the need to wake up multiple times during the night to use the bathroom. Every time you wake up and get up, your blood pressure spikes. Minimizing these nighttime awakenings helps keep your cardiovascular system stable while you sleep. Here's something else that's crucial. Monitor your blood pressure, especially in the morning right after you wake up. Morning blood pressure readings tell you a lot about what's happening during your sleep. If your morning blood pressure is consistently high, it's a red flag that something is wrong with your sleep, possibly sleep apnea or poor sleep position. Keep a log and share it with your doctor. This information is incredibly valuable for preventing stroke. If you're taking blood pressure medication, make sure you're taking it at the right time. Some studies suggest that taking blood pressure medication at night rather than in the morning provides better protection against stroke. The medication works during those critical nighttime hours when back sleeping could be causing blood pressure spikes. But never change when you take your medication without talking to your doctor first. They need to make that decision based on your specific situation. One more thing I want to mention about sleep and stroke risk. Your sleep schedule matters almost as much as your sleep position. Going to bed and waking up at consistent times every day helps regulate your blood pressure naturally. Irregular sleep schedules confuse your body's internal clock and can lead to blood pressure instability. Try to keep the same sleep schedule even on weekends. Your brain and your blood vessels will thank you. Let me be very clear about one thing. If you experience any of these symptoms, you need to call emergency services immediately. Sudden numbness or weakness on one side of your body, especially in your face, arm, or leg. Sudden confusion or trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, or loss of balance. Sudden severe headache with no known cause. These are the classic signs of stroke, and every single minute matters. Don't wait. Don't hope it goes away. Call for help immediately. The acronym to remember is FAST. Face drooping on one side. Arm weakness when you try to raise both arms. Speech difficulty or slurred words. Time to call emergency services if you see any of these signs. Time is brain tissue. The faster you get treatment, the better your chances of recovery. And remember, strokes can happen at any time, including during sleep or right after waking up, which is why sleep position and sleep quality are so critical. Now, I want to address something important. Some of you watching this might already have had a stroke or a mini-stroke, which doctors call a TIA or transient ischemic attack. If that's you, this information is even more critical. After you've had one stroke or TIA, your risk of having another one is much higher. Sleeping on your back could be the trigger that causes that second stroke. Switching to side sleeping, managing sleep apnea, and following all the steps I've outlined could be the difference between staying healthy and having another devastating stroke. Let me also say this. Age 65 isn't a magic number where everything suddenly changes overnight. These risks build gradually starting in your 50s and 60s. If you're 55 or 60 and watching this, start making these changes now. Prevention is so much easier than treatment. Don't wait until you're 65 or until you've had a warning sign. Start sleeping on your left side now. Get evaluated for sleep apnea now. Make these habits part of your routine while you're still healthy. Here's what I want you to do right now. Today, before you go to bed tonight. First, commit to trying left side sleeping starting tonight. Get that body pillow or try the tennis ball trick. Give yourself 2 weeks to adjust. Most people find that after the initial adjustment period, they actually sleep better on their side. Second, pay attention to your sleep quality. Are you snoring? Are you waking up gasping? Is your partner telling you that you stop breathing during sleep? If yes to any of these, schedule an appointment with your doctor to discuss a sleep study. Third, check your sleep environment. Is your bedroom cool enough? Is the head of your bed elevated slightly? Are you eating too close to bedtime? Make the changes that support healthy sleep. Fourth, talk to your doctor about your stroke risk factors. High blood pressure, diabetes, high cholesterol, atrial fibrillation, previous stroke or TIA, family history of stroke. Know your risks and work with your doctor to manage them aggressively. Finally, and this is so important, share this information with everyone you know over 65. Most people have no idea that sleep position affects stroke risk. They're sleeping on their backs every night thinking it's fine. You could save someone's life by sharing this video. Send it to your parents, your siblings, your friends. Post it in your community groups. The more people who know this information, the more strokes we can prevent. If you found this video helpful, please subscribe to Golden and Gray Hub for more critical health information designed specifically for people over 65. Hit that notification bell so you never miss a video that could protect your health. And please, leave a comment below. Tell me, were you aware of the connection between sleep position and stroke risk? Are you going to try side sleeping? I read every single comment, and I love hearing from you. In my next video, I'm going to talk about the 5 foods that can naturally lower your blood pressure and reduce your stroke risk even further. These are foods you can find in any grocery store, and they're backed by solid scientific research. You don't want to miss that. Thank you so much for watching and for taking your health seriously. Remember, small changes in how you sleep can make a massive difference in preventing stroke. I'll see you in the next video. Sleep well, and sleep safe.